Hi, everyone. Welcome to today's webinar, Cosmetic Labeling Requirements Across Major Markets. We're really excited to present this to you today because it really does cover markets that most of your brands are selling throughout. Throughout this webinar, please feel free to write any questions in the Q&A box. We're going to get them at the end, not in the chat section. And we've saved time at the end to answer all of your questions. So those that have joined us before, my name is Jacqueline. I've been in cosmetics for over 15 years on the formulation side, regulatory side, product development, quality management, really specializing in, the regulatory requirements throughout global, markets, and also trying to understand how changes in the regulatory requirements can extremely affect your brand, especially brands that are moving very fast paced. We also have Anna today. Many of you also know her as well, Director of Regulatory Affairs, 15 years experience in research experience, assisting companies in US FDA regulations. Anna and her team have reviewed over 13,000 product labels for FDA compliance. I mean, that's huge. And conducts a lot of trade and custom broker association seminars as well. Her areas of expertise are import alerts, detention assistance, product formulation requirements, labeling for cosmetics, OTC drugs, food, dietary supplements, and medical devices. So we are very lucky to have her today because we're going to be talking a lot about labels. We're going to go through first Health Canada labeling, the required statements, information, understanding the outer and inner container requirements, and then claims for compliance as well. We're going to also cover US FDA labeling requirements, same structure, statements, information, requirements for inner, outer. And then lastly, we'll be going over the EU, UK labeling requirements. Slightly different structure. We're going to be talking about statements, information, required information, and then claims compliance as well. So I'm going to hand it over to Anna, and she's going to kick us off with Health Canada.
Okay, thanks, Jacqueline. Appreciate it so much for all the kind words. It's always good to be presenting with you, and very excited to be able to present to all of our attendees today. So thank you for joining us. So we're going to start off with the requirements under the regulations that have been promulgated by Health Canada. Now, there are certain statements that must almost always appear on cosmetic labeling for Health Canada, as shown here, and that we're going to go ahead and discuss in depth in the next few slides. Okay, so we'll start things off with the most obvious statement of all, of course, the product identity statement. Health Canada regulations state that it should be the common name or a generic name, and it may be defined in terms of function. So it should be clear and descriptive, such as soap, shampoo, or hairspray. If using its function to meet this requirement, it should be something obvious like body wash, face cleanser, or face moisturizing lotion. Including a cosmetic function such as cleansing or moisturizing is also a really smart thing to do so that the classification of the product is clear. Now then, the next mandatory statement that we'll discuss is the net quantity. You must declare the actual quantity of the product in the container on the principal display panel. So that would be the panel usually facing the consumer at the point of sale. Solid products are declared by weight. Viscous and liquid products are to be declared in terms of volume. Now, Health Canada does have some allowances for trade customs. So, for example, a viscous product that is normally declared by weight can be declared by weight. This is pretty common in the cosmetics industry, and so Health Canada may consider it appropriate. Now, the metric amount must be declared, and the imperial declarations are optional. The type size is dictated by the size of your principal display panel and is actually based on the size of the lowercase o in whatever font you're using. Now, most cosmetics must declare all their ingredients on the package. Health Canada usually requires the official INCI name, that International Nomenclature Cosmetic Ingredients. However, they also have a special list of ingredients called the Schedule of Cosmetic Regulations that requires a certain nomenclature be used for 58 specific ingredients. So for example, you may not declare aqua with water in parentheses, which is common in other markets. You would have to declare aqua by itself or just water, and the French equivalent eau, or all three, aqua, water, eau. Health Canada is also requiring certain fragrance allergens be declared when present in concentrations greater than 0.01% in rinse-off products and 0.001% in leave-on products. Now, there are some exceptions to the rules for certain ingredients such as flavors, fragrances, and shading products. Now, the first deadline is April 12, 2026 for a list of 24 fragrance allergens to be declared. There's an expanded list of 81 fragrance allergens with a deadline of August 1st, 2026 for new cosmetics and August 1st, 2028 for existing products. Now, an extremely important labeling element will be the hazards and cautions that are indicated on the label. Health Canada requires that if a product has an avoidable hazard, then warnings are necessary. And the label must describe how to use or when not to use the product to eliminate this risk. This can be through a combination of instructions for use, cautions, and symbols. So you will want to consult the safety evaluation for your product to ensure that any hazard is addressed in the labeling. Now, Health Canada also has some specific warnings that are required for products such as coal tar hair dyes, genital deodorants, pressurized containers, and depilatories. Okay. Now, every product label needs to declare the dealer's name and address. This is the identity and place of business of the person by or for whom the product was produced. Health Canada interprets this to mean the address must be sufficient for postal delivery. Imported products may use the name and address of a Canadian dealer preceded by the words imported by, importé par, or imported for, importé pour, or a statement of geographic origin located immediately adjacent to the name and address of a Canadian dealer, or the name and address of a dealer outside of Canada. And it's also important to know that this must match Section 3 of the cosmetic notification form that's submitted to Health Canada for any cosmetic product. Now, the inner label must also bear contact information for product-related questions, and Health Canada gives a lot of options such as phone, email address, website, or postal address. So it can be the manufacturer, dealer, importer, or any other appropriate party. And importantly, it must match the information in Section 4 of the CNF form. Now, any imported products should include a country of origin on the label as well. And then last but not least, there are certain statements that must appear in the French language on the labeling, but it is optional for others. So for example, the dealer information may appear in either or both. The identity statement, hazards and cautions, net quantity, and country of origin must be in both. The ingredients list may be presented solely by the inky names, but you do have the option to translate into French if you wish. Now, while many companies understand that mandatory information that must appear on the cosmetic labels, it's also important to know that Health Canada will require certain placement of information. So here we can see what Health Canada requires for the principal display panel, again, which is that panel that is displayed or visible under normal or customary conditions of sale. So whatever your consumer will see when they buy it. So the PDP must include the product identity statement and the net quantity of contents. Note that the practice of putting the net quantity on a different panel is not permitted here. Now, other information may appear on just about any other information panel, but note that it probably should not appear on the bottom panel, as this may not be considered conspicuous enough. The information panels will need to include directions for safe use, along with any hazards or caution statements, the ingredients list, the dealer name and business address, and the country of origin. Now, there are fewer requirements for the inner container. So the front panel should have the product identity statement. The other panels will have the directions for safe use, along with any hazards or cautions, the dealer name and business address, contact information, very important, and the country of origin. Note that the ingredients themselves don't have to be listed here. Okay, now claims are a very important part of the intended use, of course, in the marketing of cosmetic products. And naturally, companies will want to highlight all of the benefits that come from a consumer using their products, especially in the extremely competitive personal care products industry. Now, Health Canada, though, does not allow therapeutic claims on cosmetics. Those that would indicate or suggest modification of bodily functions or preventing and treating diseases and other similar conditions. Certain claims, such as no animal testing, will require a company to maintain proof that such a claim is appropriate. Now, claims in general should be carefully worded. So, for example, you may claim an antiperspirant cosmetic product protects against wetness, but you may not claim it treats hyperhidrosis or excessive perspiration. You can claim that a cosmetic product removes dandruff flakes, but not that it prevents dandruff. And again, for example, a cosmetic may soothe dry skin, but it cannot soothe abrasions or irritated skin. So a careful review of your claims is an important step prior to exporting your products to Canada. Okay, and with that, we'll shift gears and talk about the requirements for the US FDA's labeling requirements for cosmetics. Okay, now there are certain statements that almost always must appear on cosmetic labeling, as shown here, and we'll discuss in depth in the next few slides. So first and foremost is the statement of identity, what that product actually is. FDA requires that it be the common or usual name used in the marketplace, or an appropriate descriptive name, or even a fanciful name as long as it's understood by the general public. FDA seems to allow for quite a bit of leeway on this. So for example, the agency even allows for an illustration or a vignette depicting the intended use, although it seems few companies would rely solely on this. Now, FDA does have some conditions on the statement though. It should not reference a single ingredient in the name if other ingredients are present. So for example, a mixture of oils could not be called argan oil, even if argan is the most prevalent oil. The statement also needs to be clear to consumers, so FDA requires it to be in bold type, reasonably related to the largest printed matter on the label, although they actually don't define what this means, and it should be on the principal display panel and parallel to the base of the package. So just like with Health Canada, the principal display panel is that part of the label that's most likely to be displayed or presented or shown or examined under the customary conditions of display for retail sale. So now the next mandatory statement we'll discuss is the net quantity of contents. Similar to Health Canada, you must also declare the actual quantity of product in the container on that principal display panel. Solid or viscous products are usually declared by weight and must include the term or abbreviation for net weight. Liquid products are to be declared in terms of volume. FDA also has some allowances for trade custom. So for example, my facial moisturizer is viscous, but it declares in terms of volume. And so this is pretty common in the cosmetics industry, and FDA seems to accept it and consider it appropriate. Now note though, for FDA, you must include both the metric and imperial terms of measurement. Now, most cosmetics, except for single ingredient cosmetics, must declare all of their ingredients on the package. And most of these ingredients must be declared by their common or usual name, which is usually the INCI, but with some changes expected by FDA. So for example, you may not use CI numbers for colors. Most have to be declared individually and not grouped together in parentheses. And they must be in descending order by weight. So with some modifications for ingredients that are present at or less than 1% and those color additives. There are also some exceptions to the rules for certain ingredients such as flavors and fragrances, and exceptions for shaded products like a line of foundations. Now, because they can vary so much from product to product, FDA does not have many specific regulations related to directions and warnings, but companies must be sure to include any that are necessary to ensure safe use by a consumer. So again, consulting that safety assessment would probably be important for FDA labeling as well. Now, FDA has published some regulations that mandate specific warnings for certain products, such as those in self-pressurized containers, skin patch tests for the coal tar hair dyes, others that are required for feminine deodorant sprays, and also tanning products. Also, products intended for use only by licensed professionals must bear a statement to this effect. The FDA requires a tamper evidence statement and tamper resistance packaging on certain types of products as well. So this would include liquid oral hygiene and vaginal products. Companies must note too that if there is a specific warning and regulation that must appear on the principal display panel, if the product or any ingredient in it has not been adequately substantiated for safety. Now, every cosmetic product label will need to declare either the manufacturer, packer, or distributor. You may choose any of these three options to meet the requirement. Note that it must include the actual corporate name and the full address, although you can omit the street address if it is found in a local directory. FDA must have a way to contact a responsible party if they discover a problem with the product. So it can be a US or a non-US entity. Now, this entity also serves as the responsible person in the context of MOCRA, the Modernization of Cosmetic Regulations Act that was passed a few years ago. So it is different than the role of responsible person in other markets such as the European Union. Now, while it's not an FDA requirement, it is important to know that US Customs and Border Protection has a labeling requirement for the country of origin on foreign articles. So this will include FDA-regulated cosmetic products. This is the country where the last substantial transformation took place, and it must appear on all retail cosmetic labels. You may only use abbreviations for countries that are deemed acceptable by customs. So for example, PRC is not an acceptable abbreviation for China, as a US consumer may not be familiar with it. So if you choose to use an abbreviation or a truncation of your country's full name, please ensure that it's acceptable to US Customs to prevent any barrier to entry. Now, if your product is manufactured in the US, this requirement does not apply. However, do note that the Made in the USA claim is regulated by our Federal Trade Commission, and the product must meet certain requirements if this claim appears on the labeling. Notably, the ingredients have to be sourced in the US as well. Now, the newest labeling requirement for cosmetics is that of the adverse event contact. Mandated by MOCRA, the Modernization of Cosmetics Act of 2022, your label must include a US domestic phone number, US mailing address, or an electronic contact, such as a website, to which a consumer can report an adverse event. Any event that qualifies as a serious adverse event, according to FDA's definition, must be reported to the agency within 15 days of receipt. Now, while many companies understand that mandatory information must appear on cosmetic labels, kind of like with Health Canada, it's also important to know that FDA has strict placement requirements as well. So here we can see what FDA requires for the principal display panel, which is the panel that, of course, the consumer sees at retail sale. Now, the PDP must include the name of the product and the statement of identity, the substantiation warning if this is applicable, and the net quantity of contents. So note that the practice of putting the net quantity on a different panel is not permitted here either. Other information may appear on just about any other information panel, but again, note that probably not the bottom panel, as this may not be considered conspicuous enough. The information panels will need to include directions, warnings, ingredients, the declaration of the manufacturer, packer, or distributor, adverse event contact, and any other information that FDA is requiring for the product. Now, FDA has fewer requirements for the inner or primary container. The front panel will need to have the name of the product. The statement of identity is optional, but it's usually included for consumer clarity. The information panels will have the same information as the outer container, with the important exception of the ingredients list. So the ingredient declarations will not be required on the inner container, thankfully, since space is usually an issue. Also, the net quantity of contents may appear on an information panel as well. Now, just as in other markets, in the US, claims are a very important part of a product's marketing, and companies also need to be aware of FDA's enforcement on product claims, particularly on imported products that can be inspected in port. FDA's enforcement is rooted in the legal and regulatory definitions for cosmetic and drug. And so by definition, cosmetics may only be intended for cleansing, beautifying, promoting attractiveness, or superficially altering the appearance, while drugs are defined as products that are intended to affect the structure or any function of the body, as well as those intended to diagnose, treat, or prevent disease. So this part of the drug definition means that claims that a product has an effect on the structure or function of the body can cause the product to be deemed a drug, even if it does not contain an active pharmaceutical ingredient. So cosmetics need to achieve their effects through superficial rather than structural change. So the benefits that are described should be linked to a cosmetic function, such as moisturizing or exfoliation. So for example, a claim that a wrinkle is erased due to collagen production in the skin may not be appropriate. But a claim that wrinkles are less noticeable because of moisturizing or exfoliating may be considered acceptable. Now, claims that exceed what FDA considers to be appropriate can result in product detention and refusal. So they should be worded very carefully in your label. It's also important to understand that some cosmetic claims in other markets, such as Canada, like antiperspirant, are considered drug claims in the US. Okay, and with that, I'll hand it back over to Jacqueline.
Thank you, Anna. That was a lot. I'm sure all of you are thinking the same. And I will always say labels are the most difficult piece in regulatory, most difficult piece to get done correctly. I can't tell you how many labels I've done personally in my life, and missed all little things that we're not thinking of. So that's why I always say put it in the experts' hands, put it in our hands, because it gets very complicated, since the labels are what is seen right at the entry of a country, right? Whether you're coming into the US or if you're shipping into the EU and UK, which we're going to get into right now. So very quickly, I know I've mentioned this many times before in other webinars, but registrar and PCR are now together, and PCR acts as a responsible person. They've been together since December 2024, and they can provide seamless end-to-end compliance services across the UK, EU. They are the experts on labels. They catch everything, and they have the best recommendations to make sure you have a compliant label. One of the things, I always talk about is having this universal label, a global label. And when we've had previous webinars, I don't know if that exists anymore, right? And after hearing Anna and what you're about to hear now, it gets a little bit more complicated, right? And as much as we want to try to have that global label, you really need to take in all of these requirements and all of these considerations, and understanding what space you have left after complying with all these regulations. A lot of what Anna talked about is very similar, principal display panels, all of that. So I'm not going to go digging deep on that. I'm going to go really into the core pieces that are specific to the EU and the UK, and kind of flag to you those pieces that directly reflect what Anna had brought with the Health Canada and the US requirements as well. So what is a cosmetic, and how is it regulated? So the cosmetic products are substances or mixtures of substances intended to be placed in contact with the external parts of the human body. So your hair, your nails, your skin, or with the teeth. And they're exclusively or mainly to clean them, perfume them, change their appearance, protecting them, keeping them in good condition, or correcting body odors. So dissimilar to the United States and Health Canada, and I always make these examples because the US and Canada have very strict OTC guidelines. An SPF would not be considered a drug in the EU and UK. And I'm calling that out specifically because there lies in we can't have a global label, right? We'd have to have two separate labels. And a lot of what I've seen brands struggle with is understanding the determination of having a primary and a secondary carton for the US for the OTC, the SPF, and then having a primary and secondary carton for the EU, UK. So very important to call that out. Blemish serums, blemish cleansers, right? So in the US and Canada, they're acne products, right? So they're drugs. In EU, UK, using the term blemish serum or blemish cleanser does not get them classified as drugs. So again, you would have two separate types of labels in that account because it would be considered a cosmetic. But some really good other examples are makeup foundations, perfumes, hair colorants, lotions, shampoos, lip glosses, all the good stuff that we love in the beauty industry. And how is it regulated? It's regulated by the European Union. They build a regulatory framework for market access, international trade, and basically they aim to ensure the highest level of consumer safety while promoting the innovation and the competitiveness of the cosmetic sector. And what this is really helpful for, especially in the EU and UK, is making sure that all regulations are streamlined across, right, all of the countries. And that's something I feel we struggle with sometimes, is when a regulation changes, we have to quickly, catch up and make the changes necessary. With the EU, those changes streamline across all countries, right? And though the UK is separate with Brexit, they do tend to follow most of the EU changes and recommendations to help keep that type of international trade open and not overcomplicate an already very complicated system. So the regulation itself for labeling is inside the cosmetic directive, and that cosmetic directive, Article 19, and we'll get into that, is the key section for labeling requirements. UK post-Brexit adopted similar rules with some rules that apply to Article 19, but then also require that products sold in Great Britain must have the UK-based RP, meaning that you'll have to have an EU, a country within the EU, and also a UK displayed on the label. We'll get into that. And then the UK uses its own SCPN portal, different than the EU. And then again, companies have until the end of 2027 to update existing labels to show a UK RP address. 2027 is not that far away. We're almost out of 2025, so you can believe how fast this happens. But very, very important. I want to call that out because that separation really determines your current cosmetic labels and how you need to make that update. New labels, new products, everything of that nature, you should be doing that as is. But anything existing or that might be already printed or things of that nature, you really want to start looking into making sure that you have those artwork updates going in. So I'm going to get into some basics because Anna did such a great job explaining so many of the pieces that are part of the label. And thank goodness a lot of the terminology is the same throughout Health Canada, through the US, through the EU, through the UK. So the package includes the container or wrapper the cosmetic product is displayed or delivered in. The label refers to any printed or graphic material on the immediate container or affixed to the package. Labeling includes all written, printed, and graphic material accompanying a product. So this could be if you have a little hang tag, if there's a little fold out panel, that is all included in the labeling and how the EU regulates that specifically. Principal display panel, as I said, is the front, is the front panel on the outer cart container visible to the consumer at the time of purchase. So that principal display panel, as Anna has spoken about before, right? That is the first contact the consumer has, right, with the product. So all the information on there has to be visible, be clear, and that is why they require mandatory information on the PDP specifically. Information panels refer to back and side panels of the package. Label. Cosmetic labels must be labeled appropriate to direct consumers toward important information for safe use of the product as well. Outer container, again, is the package that houses the container holding the actual product. Inner container holds the actual product. And then again, both outer and inner have to display all readable information. If you do not have an outer container, right, a secondary carton or any type of outer container, all the mandatory information needs to be on that inner container, because that now is your outer container, right? And that will display front facing at the time of purchase for the consumer. So very important to know that. So we're going to go through each of these individually, but here's an view of the mandatory labeling requirements for cosmetic products that is outlined in Article 19. And again, quick snapshot of what we're going to go into. Most important is the responsible person designation. And it has to be an established entity legally responsible for ensuring that a cosmetic product complies with cosmetic regulations. This can be the manufacturer if they're located in and have a physical address. If not, you can designate an authorized representative. The importer, again, is the entity that places a product from another country onto that market. So the authorized representative has to have their name and address on the product label. It's so important to know that before you go into artwork, before you go into printing. And again, that responsible person has other key parts that they have, such as the speaking with authorities, holding the PIF, dealing with undesirable effects, right? So there's a lot that goes into the responsible person, but on pack is very important. So as I said before, products sold in the EU must have a EU responsible person, and products sold in the UK must have a UK-based RP. Both these addresses need to be reflected on the label, and they have to be complete enough that you're able to contact the responsible person if need be. And this is mostly due to undesirable effects or quality issues with the product. Has to be able to be contacted. I know I've said this so many times before, but make sure you pick a great responsible person partner, someone like PCR, because once that goes on that label and once that is notified a certain way, it is very difficult to unravel yourself from a responsible person. So it's really important to pick someone who has a lot of expertise and a lot of experience in both the EU and the UK, because that's going on your label. And we all know what plate changes and changes to artwork costs. So the less is better. Next, we're going to talk about the net content. And again, this is the nominal content at the time of packaging given by its weight. So for example, grams or kilograms, or in volume, must be in metric. So very similar to Health Canada. There are some exceptions. So packaging containing less than 5 grams or 5 milliliters, any free samples, single application packs, and then in certain cases, it can be replaced by stating the number of items in the package. So if you have press-on nails, for instance, right, you can say contains 10 press-on nails, right? Also, the E sign can be put on the label if the requirements of the directive, of this specific directive for net content are met. And the E symbol signifies that the average quantity of the product in the batch is not less than the nominal quantity stated on the label, which is that tolerable negative errors defined in the directive. I don't see so many brands doing this anymore, and and that's specifically because there's such a need for a global label, but we definitely want to mention that that is a part of one of the directives in Article 19. Okay, so this is different from pieces of the US and even certain pieces of Health Canada is the date of minimum durability. And this is really important because this directly relates to the information you need to put on your cosmetic label. So first, the expiration date. So the date of minimum durability is the hourglass symbol plus the expiration date, or best use before the end of date. If necessary, the container which must be satisfied to guarantee the stated durability that's mentioned. So you go by batch, when you make your batch, fill your batch, and then that gets kind of inkjet on, lasered on, or embossed on, and next to this hourglass symbol. This is not mandatory for products with a minimum durability of more than 30 months. In that case where you have your stability, right, and you've completed your compatibility, your stability, and you can show a durability of more than 30 months, then you don't need to do an expiration date. You could do a period after opening date. So for products with that fall into here, they will have that PAO symbol, so right, like an open container, plus the number of months or years the product is still safe to use after it's been opened. So for example, this says 12M, so it means 12 months. I got a lot of questions about this. Can you have both? It's not recommended to have both because it confuses the consumer, right? Is it the expiration date, or I opened it and now I get 12 months? And that might be past the expiration or the best use before end date. The only time I've ever seen a PAO with an expiration date is when you're launching when you're still under stability and you have not completed your full stability to gain that 30 months, meaning that the expiration date would eventually come off, right, the pack. I don't recommend this. It gets flagged a lot in retailer stores as well. So I know that question was coming, so I want to answer it for everyone. But this is the best way to handle the expiration date and then the period after opening date as well. Precautions for use statements. So if the cosmetic requires any special handling, warnings, or safety advice, this information must be clearly displayed on the label. It also has to be written in the local language. A lot of people forget this piece. And you have to remember that through the EU, there's multiple languages, right? You have French, you have Spanish, you have Italian. So anything that is a precaution for use needs to be written in that local language. And it has to, if there is a warning, right, there has to be a predominant and easy to understand warning. There's also ingredient triggered warnings mandated by EU and UK law, such as hair dyes, AHAs. All ingredients are listed through annexes 3 to 6, and they basically will tell you that this ingredient bears a warning if you're using it. There are also storage guidelines. I don't see this as often translated into every language, but it's very useful to translate into every language so that if the product, degrades faster in hotter temperature, or if it's a stick, right, and you're not supposed to have it above 100 degrees, right, understanding where and how to handle that product helps keep the quality of the product as well. And then general use warnings, right, for external use only, avoid contact with the eyes, keep out of reach of children, things of that nature should all be clearly stated on the label. Batch number. Many of us already do this, but I will say that there has been discrepancies in batch numbers. I definitely know that it helps brands track, right? So the batch number is the reference for identifying the cosmetic product in terms of its manufacturing date, right? So sometimes you will see, a label that says batch number 12011, right? So then you're able to understand that number is associated with a specific manufacturing date, a certain shift, right? And that way you can track that finished good back to original batch. A lot of people use the AB 1, 2, 3, 4 method, right? So the month, A represents January, things of that nature. It could be printed, stamped, or embossed, like I said. But again, it allows the product to be tracked back to a specific manufacturing batch, which is essential for that quality control. And it is also helps when there is a recall, right? If there's a specific batch to be recalled, you can recall that specific batch due to that lot number. So a lot of times we'll see things on, you know, the news, like recall. I think there was just one recently with makeup wipes, right? And they put that lot number right there and said, if this is your lot number and you have these makeup wipes, throw them in the garbage, right? And there was contamination in it. So that was a quick and easy way for them to control what lots and product had to be destroyed versus having to recall, right, several batches and several lots that did not need to be. Ideally, it should be on both the outer package and the product container, but I do have seen more recently just putting it on the product container. If the container is too small, just having it on the outer box is acceptable. And then also, this is really critical too for anything to do with an undesirable effect, right? Chasing it back, right, to the batch and understanding what could have occurred or what might have happened to that specific batch that could have caused an adverse event. Again, so recommend making sure you understand if you're your own company's manufacturing, or if you're using a contract manufacturer, understanding how their lot code system works, especially their batch numbering and how they do that. Many times I feel we kind of just let them, you know, take care of it. And then when there's an event that someone's giving us a lot number to, that we're not quick to know exactly what that is. So highly recommend asking your manufacturer that process so you can have that easily accessible if need be. Product function. So cosmetic labels must clearly communicate what the product is and what it's meant to do. If it's clear on the packaging what the product is, you don't need to have an extra description. So if it says, you know, shampoo, you don't need another additional function description. But if it's unclear, say it says summer mist, you know, you need to clarify it's a hydrating face mist, right? And this prevents the consumer's confusion and supports both safety and correct use. The function doesn't need to be lengthy, much like what Anna said. It could say moisturizer or anything of that nature. And the product function too, and we'll get this a little bit later, has to be translated right into all the local languages that you sell that product into as well. So very, very crucial to understand that this is one of the main ones that need to be translated into those local languages. I don't know if anyone's seen the video, but there's this hilarious video of a woman cooking dinner, which is this beautiful chicken, beautiful sauce, and she spent $30 on this bottle of olive oil. And the daughter comes out and realizes it's olive oil shampoo, which is clearly stated on the bottle, right? So things like that, you know, you have to take a laugh at, because a lot of our cosmetic products have beautiful labels, have beautiful artwork, but we got to make sure that everything is clearly stated, especially what the function is. Ingredient list, nothing new here. Cosmetics must display the full ingredient list on the outer package. You must use the international nomenclature of cosmetic ingredients. Use standardized internationally recognized names. So aqua instead of water, perfume for fragrance. But much like Anna said, you can have that slash of that water, aqua, and must be listed in descending order by weight. Ingredients under 1% can be listed in any order after the main list. Colorants can be grouped at the end. And this is, you know, if you have multiple shades and do the may contain, so very helpful to have it at the end. The word ingredients in English or the local market language, a nanomaterial require. So if there is a nanomaterial, you need to have the nano determination next to it. And then colorants in that CI color index must be used. So your CI 77492 has to be listed in, I normally do it in parentheses. So, you know, I'll say titanium dioxide and then put the CI in parentheses after. But very important that the CI color index needs to be used when listing your colorants at the end. Directions of use. So all cosmetic labels should have clear use instructions printed on the label. They should state the amount of frequency of use. They should be verified through consumer or testing studies to determine the correct amount and frequency of use. And they should align with any claims about the product, should be clear to understand. And again, it is very important. The directions of use are are easy to understand because this is the overall product safety use for the consumer. This is also evaluated during the consumer product safety report as well. So during the CPSR, they will, you know, your responsible person will ask you, right, like a frequency of use, how much, if you squeeze it, you know, 3 milliliters come out, something of that nature, right? And then that can determine, right, how much gets absorbed into the skin, the margin of safety, right? All of this plays into facts. So very important your directions of use are clear and that you have a clear understanding for your responsible person, because this all goes a part of that safety evaluation. Additional requirements. So in the UK, all mandatory label information must be in English. I don't think that's a surprise. In the EU, each country requires key details to be in those local languages. So product function, warnings, expiration. If you have a best before the end of instead of an EXP, precautions of use, and then the nominal content. You know, I have struggled very much in the last few years of getting everything on a label, especially in the local languages. It's very difficult. So you really want to work with experts that know exactly how to fit it, how to do it correctly, the translations, that they make sense. So very important working with someone that understands those little details, because that can really change the way that your label looks. I've seen it, right? I've seen it transform from a mess of words and letters to something a little bit more friendly on the eye and definitely friendly in the retail store. Products country of origin. So if it's imported into the EU, must state made in, so made in the US. Claims compliance, so proof of the effect claim on the label, and then must provide testing or studies to support printed claims on labels. So this is a huge thing that I've seen more recently. The EU, not so much the UK, but more the EU crack down on, because we have these crazy claims out there of, can make your wrinkles, less noticeable in 30 seconds, right? So having the right testing and having the right studies to show that is really, really important. I've seen tons of brands doing these clinical studies, right, and clinically proven, right, because they want to make sure that they have that data and that information to back them up. One thing to note too, for US and FDA, we've seen them crack down as most I've ever seen, I think, in the history of cosmetics and beauty, because they really want the consumer to understand what the product is doing and that it's not over promising, and that there are substantial claims to back up what's being said. This is not the 2000s anymore in cosmetics. We got to show what the product's doing, got to have ingredients at levels that are effective, and we want to be truthful, right, to the consumer, what we're promising when they purchase the product. Now, I've had this slide before in previous webinars, because EU, UK, shipping, if you're a US brand and shipping there, or outside of the EU, UK shipping there, they probably have one of the most strict local authorities upon import that I know of. I have seen so many detentions, so many fines, products on hold, right? And one thing I want to point out is that, when you're delivering to your local authority, right, upon import, the first thing they see is your label, right? That is it. They see the label, they see the product. There's no question about it, right? It's a cosmetic coming into the country. And I have seen many times a non-compliant label getting stopped and the brand having to relabel at the port of entry, or brands having to take the goods back, right? So you don't want that to happen, because this is the first thing, right, that local authorities will see when you're bringing that product into that country. So if you're still feeling a little overwhelmed, I hope we navigated you guys pretty well. We want to give you the basics, but if you are still feeling a little overwhelmed, please come speak with us. Registrar has more than 30,000 clients. Like I said, over 13,000 label reviews. We will help you get through any label that you might be struggling with, or if you have labels and you need to recheck them because maybe you didn't have that initial check, right? That's definitely something that our team can help you get through. So we're going to jump to the Q&A. I'm going to bring Anna back on here when she's ready. Okay, there she is. And then I just wanted to point out, just in case we start bumping up against the top of the hour, if you do have more questions, please reach out to John. He is amazing, and he will get you to the right expert, to the right practice, so we can help you get your label to be compliant.
Okay, yeah, John and his team are phenomenal, and so definitely do reach out. I'll go ahead and start in with some of the questions that we've got. And let's see, I'm going to start with a question about color additives. Do color additives for cosmetic products sold in the U.S. require use of FD&C codes, such as FD&C Blue Number 1 or PCP Inky Blue Number 1 or the CI number are acceptable? Okay, great question. You've identified a very common issue with products that are being exported to the U.S. that contain color additives that require what we call batch certification. So certain synthetic colors, like the ones mentioned, in the US, you actually have to get FDA to test the actual color additive from the batch once it's been produced and before it's been added to a cosmetic product. And if you are sourcing any of these colors that are subject to this batch certification requirement, you absolutely need to talk to your color supplier and find out whether or not they are getting batch certified. FDA issues a unique lot number to each batch that they certify. And when you ship, FDA quite possibly will ask you for proof of that lot number. They'll want the lot number, and they may even want manufacturing records to show that that exact batch was used in the product that is sitting in the port of New Jersey. So we see this all the time. It's a very common problem. And you absolutely need to use that FD&C or DNC name on the label when it comes in. If it comes in with just the CI number or with just the common name like Ponsor or Carmosine or something like that, FDA will just automatically assume that it's not been properly certified and they'll detain it. And unless you can prove that it was certified, then they'll refuse entry. And there's no way to fix that problem because batch certification is a requirement. So excellent question, and I thank you for raising it. Okay, so I'll go ahead and grab another one. Let's see. I'm getting mixed advice on the, as a small business, being exempt from product registration for the US. So I just want to check that we don't need a separate US agent at this stage. So I'm presuming that you may be talking about the establishment registration under MOCRA, which is required for certain manufacturers and people that perform those types of functions. There are some small business exemptions. I encourage you to go to our webpage. We have wizards there that will take, ask you questions and take you step by step through the process. So for example, there are certain small business exemptions, but not if you make a product that's going to come in contact with the eye, other types of products where you aren't going to be able to qualify. They nullify the small business exemption. So there are a ton of tools on our webpage. So please, I encourage everyone to go there, especially if you have questions about MOCRA with registration and listing for the US market. All of this is very new to industry, and so we have a lot of resources available to you in order to make sure that you have all your requirements covered before you start shipping. Okay, maybe I'll find another one before I hand it over to Jacqueline. We've got a ton of questions. This one, for the U.S. adverse contact, it stipulates U.S. domestic, U.S. mailing or electronic contact. The wording would suggest the electronic contact does not need to be in the U.S. Is that correct? Therefore, a UK-based company could use their existing address and email or website. So the answer is yes. One thing I will tell you, though, is do make sure that it is very apparent from your website, if that's what you're using, in order that a consumer can find it easily. I know people don't necessarily want to have their homepage say to report an adverse event, go here, but FDA, the whole point of this is that a consumer can easily respond to, respond to a company with a report of an adverse event. So, make it front and center, make it very clear what the purpose of it is so that you won't run into problems with FDA thinking that it's not sufficient to meet this requirement. Okay, I'll toss it over to you, Jacqueline, for some questions.
Yeah, we have some really good ones. And again, if we don't get to your question, please email John and we will answer all questions. I'm so glad that everyone has a lot. So first question up, if there's no place to include cautions in all languages in an inner package, is it possible to include them only on the outer and add a handbook symbol in the inner package? So 100% that is the way to do it. Most people will do a little leaflet and have all the warnings translated in the languages. And then on the outside will be that little handbook symbol to basically show that there's an additional leaflet or additional information in order for the consumer to view and to read. So great. That's like such a great question because all the time it's like, how do I fit all these warnings and cautions onto the packs? And it's getting harder and harder, honestly, to do so. But and then I see a question here about safety testing being mandatory. So there is mandatory safety evaluation, that CPSR that we talked about for the EU and the UK. Under MOCRA as well, you need to have substantiation of safety as well as for Canada. So Health Canada, when you do your notification, you have the option to upload your safety information at that point, or when Health Canada contacts you asking for additional information. But it's mandatory for all of the countries that we spoke about today. They're just slightly different in how they handle that processing. I saw another great question. Somebody asked when the RP was being required on packaging. So this went into effect in July of 2023. So if you're selling in the EU, UK, for the last over 10 years, this has been the requirement. And there was an additional question saying if you had ampules, so if you had single-use products inside, you can't put the RP on the ampule, obviously. So in that case, it's okay to have it on the outer carton because there is nowhere to print it on the actual ampule inside. So really great questions coming out. Let me take there's one question about for the US, the RP does not have to be physically in the US. So the RP doesn't have to be physically in the US for MOCRA, but if you are an outside facility, you need to have a US agent who is physically in the United States. So very important to make that determination. So if you're a brand outside of the US and you do not have your own manufacturing site, you can still be your own responsible person. But if you are a brand with a manufacturing site, you need to have a US agent. Very important to make that difference, especially when we're talking about the EU and the UK having to have someone physically there, right, to represent that brand. And now with Health Canada as well, right, having that responsible person in Health Canada who is physically in the country. I had saw one more one that was pretty good. Where'd it go? Do all ingredient lists require all ingredients, even if below 1% and non-hazardous? Not sure what you're asking. All ingredient lists require all the ingredients to be listed. There are cases where there are residuals or impurities, a part of an ingredient that do not need to be listed. Those documentations come directly from the raw material supplier. So very important to know when you're asking for documentation to ask for the compositional breakdown. The compositional breakdown will then show you the ingredients, right, that have to be listed and any residuals or impurities that do not need to be listed on the ingredient list.
If I'll add in too that there are sometimes incidental additives that are just sort of, part of the manufacturing process that in some cases don't have to be declared, but I would encourage you to go directly to the regulation, figure out what the definition for incidental additive is under that regulatory framework if you're trying to decide whether or not to neglect to declare a certain raw material or substance that's been used in the manufacture of the product.
I did see a couple questions about languages. And again, the most important thing to remember when you're thinking about languages is where you're selling to, right? If you're selling into just the UK, right, and UK just requires English, there isn't a requirement, right, for the local languages in the EU. And this is specific to, if you're selling into France, right? If you're selling your products into France, you need to have those French translations, right? More specific to Canada, right, where everything needs to be translated under this new Quebec bill, right? Everything needs to be prominent and translated, right? That's where you're going to see everything on the label, right, being translated into French, right? So it's very important to understand your distribution network and understand where your product is being sold, to understand which languages you need to translate those mandatory pieces of the label into those local languages. And again, a lot of this, some of it can be moved to leaflets, some of it can be moved to the inside, the inner container, fold outs, things of that nature. So, but first understand what country you're selling in. If you're not selling in every country in Europe, then don't translate for every country. We're at the hour. We're actually a minute over. I just want to thank everyone for joining us today. If you have any additional questions, please reach out to John. Anna and myself will be more than happy to answer them for you. And we hope to see you at our next webinar.